Thank you, Mr. Speaker. I think that what strikes me about this process is that there actually is common ground here. We can agree on the goals we want. We want to lower cost, we want to increase access, we want to have quality care. But I think the problem that we are addressing is that there, if you will, is a philosophical divide as how do we approach that. And so I liked what Dr. Fleming said, Mr. Speaker, when he spoke about how if we can empower patients, we can lower cost. One example I like to use of how we empower patients is health savings accounts, which the Republican alternatives all strengthen and the Democratic alternative weakens. In a health savings account, imagine what is currently the case where a family of four puts up $12,000 a year. At the end of the year, if they haven't used any resources, then they put up another $12,000, and the year after they put up another $12,000. But in a sense, it's starting over every year. With a health savings account, you sluice off some of that money and you put it into a banking account. And the family controls that account. The patient is empowered to make wise financial decisions. If at the end of the year they have money left over in that account, it rolls over till the next year. They actually can hang on to it. Two examples of how this works. A friend of mine back home, a woman of somewhat wealth, has a policy that pays for everything. As it turns out, Mr. Speaker, she doesn't care what it costs because her insurance policy pays for everything. She says she doesn't look to see if the doctor gives her a generic RA name brand drug. She doesn't look to see what the bill says. She knows the insurance will pay for it. She doesn't go through her itemized list to make sure all expenses are appropriate. Contrast that with another fellow. I mentioned to him about the power of health savings accounts. He goes, I have a health savings account. I go to my doctor. My doctor writes me a prescription for medicine, and I know from experience, I tell him, that it cost me $159. Now notice, Mr. Speaker, he didn't say 160, he said 159. Because it's his own money, he is looking at the itemized deduction. And he says, I have a health savings account. Do you mind writing me something less expensive? The doctor says, oh, I'm sorry. You have a health savings account, tears it up, writes him a generic, which costs $20. The system just saved $139. Not because a bureaucrat in Washington, D.C. said, thou shalt, but rather because someone looking after his own financial interests made the best decision for his health care. Now, we know this works on a systemic basis. The Kaiser Family Foundation did a study. It compared a family of four, their expenses with a health savings account and a wraparound catastrophic policy, with a family of four which had a traditional insurance policy. The family of four with the HSA catastrophic, they paid 30% less for their coverage than the family of four with the traditional insurance policy, and both families, if you will, were equally likely to access preventive services. So we see, by controlling costs, we increased access to quality care. And we did it by bending the cost curve. What concerns me about the bills advanced by Ms. Pelosi is that, according to the Congressional Budget Office, the inflation rate for these bills is 8% per year. Now, President Obama says we have to have reform because cost will double in 10 years if we do not. As it turns out, with the reform that we've been presented, costs more than double in 10 years. At a minimum, reform should not cost more than status quo, but actually it does. And if we don't control cost, we know that if we don't control cost, access is denied. Now, we can always make that up by increasing taxes, but when you start off with a bill which increases taxes by $730 billion, it doesn't leave a whole lot of room, Mr. Speaker, for increasing taxes anymore. At some point, your increased taxes drive up cost, which decreases access, which means you have to spend more, and you increase taxes even yet more. It's not wise public policy. So in closing, I'll yield back after saying that I think our Republican alternatives concentrate the power with the patient. It is patient-centered, empowering patients. We contrast that with the bills that are before us, which frankly which concentrate power in Washington, D.C. by collecting taxes, 111 bureaucracies, boards, and panels, which will, again, take power away from the woman with her doctor in the exam room in her hometown and transfers it to Washington, D.C., where someone will attempt to dictate how that interaction takes place. And I yield back.
Mr. Speaker, I